Welcome to In Bed With. I'm Dr. Sherry Ma, and today I'm joined by Dr. Shelby Harris. Welcome.
Thank you so much for having me.
Yeah, excited to be here.
Same. I'm really looking forward to talking with you.
Well, tell me more about your work with women and sleep.
Yeah, so for 20 plus years now, I've been working mostly in the insomnia space, but I do treat narcolepsy, sleep apnea, like all these different areas. But really within the insomnia space, so many of my patients over the past few decades have been women. This was before we were talking about menopause in the mainstream like we are now, since the pandemic really started to happen. And it's just a passionate area that I have because so many women for so many years were told this is kind of what happens as you get older. And even before we would talk about MHT, menopause hormone therapy, before that became kind of more acceptable to be used as a treatment for a lot of people, people were like, it's either meds or nothing. And we have a lot of things that we can use to help women that it's really like just to suffer for the sake of suffering is just unacceptable in my book. So we have, like, for example, cognitive behavior therapy for insomnia. We have ACT therapy for insomnia. We have medications. We also have menopause hormone therapy that people are being prescribed more. There's not one size fits all. Even women who sometimes have sleep apnea that go undiagnosed because they're younger, they're thinner, it's just they don't fit the typical bill of what you would think sleep apnea is. We were talking about it being rewarding when someone gets a good night's sleep. That to me, when I see a mom, a woman who's in their 40s, 50s, who's just been suffering for 10, 20, 30 years, now start to understand what good sleep looks like, it's a game changer.
Definitely. And I think you hit a point too about how women can present differently than men in their sleep concerns, their sleep disorders, or even some of the questions that I see as well. Because, women who have sleep apnea, it's not always the typical snoring or being really overweight as initial symptoms that may trigger a conversation with a provider, right? It could be the fatigue or unrefreshing sleep, or it could be, the insomnia that actually triggers that pathway to evaluate if is sleep apnea.
Yeah. And then there's the stigma too, right? So there's the idea of if I bring up a sleep issue where I'm really tired to my doctor and I just don't feel like my sleep's unrefreshing, a lot of women are afraid that they're going to automatically be told, well, it's because you're in perimenopause or menopause or because you have depression. And maybe that could be true for some of it, but a lot of times it's not. And I see it's interesting in my practice, people come to me a lot for insomnia. So they're coming to me for insomnia, and then after just talking with them in a full intake, it becomes very clear to me that they need to be evaluated for their sleep apnea as well, because we see COMISA, comorbid, co-occurring insomnia and sleep apnea. So we see them hand in hand all the time, but the sleep apnea part is just totally missed, and I'm the one who has to actually say, well, let's get you evaluated for that as well. And we have a lot of work to do when it comes to education in the field. Like the fact that we're talking about this now is so big, and there's so much just misinformation, and just physicians don't know necessarily. They're not always thinking sleep apnea as a potential thing. It's insomnia is the thing that gets talked about more than anything else.
I know that the Resmed Global Survey specifically asked women about their struggles with getting quality sleep, as you've discussed. And I believe that there's 44% that in women who are in menopause say that they struggle with sleep, 3 days out of the week, versus those that are not in menopause, I believe is around 33%. So there is this larger group of women who really have difficulties getting the rest that they need every week.
Yeah, I'm not surprised. It's sad, but I'm not surprised. It's almost like a perfect storm of three different areas. So we see hormonal issues that are going on when we see sharp drops in estrogen, progesterone. That's really what's fueling a lot of it. Then we also see higher rates of anxiety and depression in women. And then we also see more social stressors. So women in midlife are having kids later than they did before. They're also in the sandwich generation. I know I'm there, right? I have kids, and then my parents are aging, and then work, right? Work is just, women are working more than ever before, and things are 24/7, right? With phones and everything. There's just no time to turn off. So we need to address those three areas to really get at the root of what's going on. But yeah, I think just being better at assessing and just knowing that it's not normal to feel like you're dragging every single day. And if you think something's off, you need to bring it up.
Are there certain time points in this progression, whether it is perimenopause, menopause, postmenopause, that you really think women should stop and take a second to evaluate how their sleep is, or come talk to a provider when they have the beginnings of maybe some concerns?
Yeah, when it comes to insomnia, for example, I like the idea of 3 or more nights a week where it's problematic. I think also the problem in our society too is that when we've gone from this shift of like sleep disorder talk to
Sure.
sleep health, it's almost been like we're expecting perfection every day. I don't sleep perfectly every
Right.
single
Yeah.
night, right?
No, neither do I.
Right. So I think if you start noticing that you're not feeling refreshed, your timing is off, the quantity is off, there's something just not like it had been, and it's happening I would say 3 or more nights a week, and it's going on for a few weeks, that's when I would definitely bring something up. I don't think the time point in your life really matters,
Yeah.
because there can be a million reasons why you might develop sleep problems, but hormonal changes, pregnancy, adolescence even,
Yeah.
postpartum. We see it at different times, but whenever you start to notice something's off, you should say something.
Yeah, no, I agree. I think so many, not just women, but
Yeah.
a lot of individuals go for much too long,
Yes.
struggling with sleep, not even just for weeks, it can be months
Oh my
or
gosh.
years.
Yeah.
Like, why did you wait
Well,
for a decade to
that's
come address some of these questions and concerns?
that's the big change I've noticed too in the field, with more talk about sleep health in a good way, right? For ages, I saw people who would come to me with insomnia that had insomnia for 20, 30 years. That was not an uncommon story. Now it's 4 or 5 months, which is like a game changer.
Yeah, no, I think that that's definitely helped
Yeah.
get people to be more aware of their habits and then be able to seek help faster.
Exactly.